Hi everyone, it's Miss Cara from the Wansell office, and for today's Therapy Tip Tuesday, I'm going to be discussing fluency strategies for individuals who stutter. So there is something called developmental stuttering, and this occurs between the ages of 2 and 5, and it usually occurs in children when your speech or language lags behind a little bit, and it can affect how quickly you can get your thoughts out sometimes. I'm not going to be talking about this type of stuttering. I'm going to be talking about the other kind of stuttering that happens later on, and it can last and it needs to be treated. So one thing that I think that is really important to explain to individuals who stutter is I like to explain the vocal process and how we make voice. So we have different levels of sound production and how we get there. So the first thing we have to do before we start speaking is we need to breathe. Yes, we need breathing to speak, but the number one thing we need speaking for is to sustain life. So the second feature of breathing is for speech production. So first, everyone taking a deep breath and let it out. So I needed that deep breath to start talking, and maybe we might not take such a big breath like that, but it's important to keep breathing, especially when we're reading or speaking into longer sentences. But that's the first level, and then we get to the level of the vocal folds, or the vocal cords, and that's where we make phonation. So that's where our vocal folds vibrate and go in and out, and we stretch them to change our pitch, and we have to make sure that respiration is enough, we have enough power from that respiration to power the vocal folds. And once those get in motion, it's a lot easier to continue. Then we get into resonance, which usually takes place in the different cavities, so the oral cavity, the nasal cavity, and the pharyngeal cavity. And it's kind of how we shape the air to sound the way we sound, if that makes sense. And lastly, we have articulation, which occurs around our mouth. So it's our teeth, our tongue, our lips, all those are articulators, and they help us shape our sounds as they come out of our mouth. So that's the last level that we need. So for fluency, I think the most important one, honestly, is respiration. I've seen a lot of progress in some of my patients when we focus a lot on respiration and relaxation. So if we're not taking in a good enough breath, a lot of times I'll see this tension in the upper extremities or in the laryngeal area right here. And when that happens, it makes it a lot harder for words to come out for your vocal folds. And that's very difficult, and that will cause more stuttering. So my professor in grad school actually explained it so amazingly great to us on what stuttering is. So we hear about blocks and repetitions at the word level, the phrase level, the sound level, and we hear about prolongations. So a block is you can't get that sound out. So you might go do, because you can't get it out, and I blocked on the D, so you couldn't hear that D sound. And then you can have sound repetition, so you can hear d, 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 do. And there, technically I blocked on the O, because I was getting that D sound out. I got the D, but the O was what was really holding me back. So technically you said that disfluencies are really blocks, but it's how it's being blocked that's important. So right there, I didn't block on the D, I blocked on the O right there, but it came out as a sound repetition on the D. Then you might have one like a prolongation, which is so. And if you saw there, I also added in a secondary characteristic, which was the eye blinking, trying to get out of that block on the O. So you saw this and then the O. So a lot of times I'll have my patients start by taking a deep breath and using an easy onset to get that phonation going, so it leads us into that voiced consonant or voiced vowel. So usually it's a lot harder to produce a voiceless into a voice for people who stutter, because your vocal folds aren't really moving for those voiceless consonants or those voiceless sounds. So if you put your hand here and you make the S, your vocal folds don't move. If you make a Z, it moves. And those sounds are cognate, so they're made the same exact way. The only difference is that one has voicing, which is the Z, and one is voiceless, so the S. So if I'm going to say the word so versus zo, For someone who stutters or for someone who experiences disfluent speech, the zo might be a little easier to start and end together than the so, because you're going from voiceless to voice on, and that can be really difficult. So I like to use an easy onset. So we'll go so and try to get those vocal folds moving in order to produce those sounds. So one area that we really target with some of my patients is reading, because I know reading can be very difficult for individuals who stutter because you can't really talk around the words that you want to say. So people might use circumlocution, so talking around the word that they want to say. And an example of this would be if I'm trying to think of the word soap, I might say, the thing that you wash your hands with, it's in the bathroom. Usually it has a pump and you have to pump it into your hand. And I'm totally not saying the word soap, but you know what I'm talking about. And someone who isn't really aware that I'm stuttering and I can't get to that word soap might not think twice of it. They'll just be like, oh, you mean soap? Yeah, I mean soap. Perfect. So reading is very difficult because you don't have the opportunity to do that at all. You have to read what's there, especially for kids who are in class and they're doing like popcorn reading. Everyone can see the words on that paper. And that's an extra stressful environment for kids sometimes. So we want to make sure that we're giving them the tools they need to read fluently or speak fluently in those situations, especially. So when we're reading, I really stress the importance of breath support. So we'll do deep breathing before we start, and then before we start reading. And if someone's experiencing those disfluencies again later on, we'll take a break and then we'll take some more deep breaths. Maybe do a relaxation exercise like a head roll to kind of relieve some tension in here, or some shoulder rolls to relieve some upper extremity tension there. Because when there's tension, we need to relax, because then if there's tension here and here, there's going to be tension by our vocal folds, and that's not going to give us the fluent speech that we want. So that is it for today. Happy Therapy Tip Tuesday. Tune in next week for my last Therapy Tip Tuesday. Have a great rest of your week.